right. Good afternoon, Ms. Schweigert. My name is SBell. I'm going to be your nurse today. I'll be taking your medical history. Before we begin, can I have you verify your name and date of birth?
Yes. Heike Schweigert, 62387.
Wonderful. All right. And then can you identify your race or ethnic origin for me?
Hispanic?
Fantastic. And do you identify as female?
I do.
Fantastic. All right. Can you briefly describe why you're seeking care today?
Back pain, lumbar area.
Okay. And then how would you describe your overall health?
Fair.
Fair. Fantastic. We're going to talk about your childhood illnesses. I'm going to list a few and just let me know if you've had any of these, okay? Measles, mumps, rubella, chickenpox.
Chickenpox.
Okay. Rheumatic fever,
No.
polio.
No.
Okay. Any major accidents or injuries in your life?
Just when I was in service.
In service?
Yes.
Can you describe that accident for me?
It wasn't really more, it was an injury. I was taking combatives, and I think that's when my back pain started
Okay.
in 2013.
Fantastic. Thank you for telling me that. All right. And then I'm going to list some other symptoms, and I just need you to say yes or no to them, okay?
Okay.
Diabetes?
No.
High blood pressure?
No.
High cholesterol?
No.
Hypothyroidism?
No.
Have you ever had a goiter?
No.
Any type of cancer?
On my family side, yes.
On family
not
side? Not you. Okay. Leukemia?
No.
Psoriasis?
No.
Angina?
No.
Any heart problems?
No.
No heart murmur?
No.
Okay. Pneumonia?
No.
Anemia?
Yes.
Anemia.
During pregnancy. And
Okay.
a little after.
Pregnancy. And then what about asthma?
No.
Emphysema?
No.
Stroke?
No.
Epilepsies, cataracts?
No.
Any kidney diseases or stones?
No.
Crohn's disease?
No.
Colitis?
No. Is
No.
that a skin condition or colitis? Okay. No.
All right. Pulmonary embolism?
No.
Jaundice?
No.
Hepatitis?
No.
Any stomach or peptic ulcers?
No.
Okay, and you said no to rheumatic fever earlier, correct? All right. Tuberculosis or HIV and AIDS?
No.
Okay, fantastic. And you said only during pregnancy you had anemia, correct?
Yes.
Awesome. Okay, did you have any hospitalizations with those pregnancies or any other hospitalizations?
No. Normal.
Okay, and then what about when you were doing the combatives in 2013? Nothing
No.
there, no stays? Okay, fantastic. I love that. So never been hospitalized. Have you ever received a blood transfusion?
No.
Okay, and then what about operations? Any operations throughout your life?
Yes.
Okay.
Ectopic pregnancy and cesarean.
Okay, and what was the year for the ectopic?
2021.
Okay, and what about the C-section?
2021.
Awesome, and then which hospital were these done at?
Metroplex.
Okay, and then obstetric history. So you said C-section. How many pregnancies have you had?
5 in total.
5 in total. And then did all of them come to term?
Yes, with the ectopic, obviously.
Okay, and what about preterm pregnancies?
None.
Okay, and then how many living children do you have?
4.
Okay, and you said 1 incomplete pregnancy?
Yes.
Okay. All of them were to term, 4 to term. Fantastic. Okay, now I'm going to check about your immunization. When was the last time you had your tetanus shot?
Is that the Tdap?
Yes, that's one of them, yes. They go
I
together.
believe I had it last year during like 7 months pregnancy or whatever shot they gave you.
Okay, so that was what, 2021?
2021.
And mid-year? You said
September.
September? Okay, what about your Hep B, hepatitis B?
I'm not sure. Probably when I was in the military.
Okay. Meningococcal?
Not sure.
Okay, what about your COVID-19? Did you receive that?
Yes, first 2 doses.
Okay, do you remember the date you got them?
I got them probably in September and October 2021.
2021?
Yes.
Sorry, technical difficulties with my computer. It's too fancy for me. September 2021. Okay, have you ever had a pneumonia vaccine?
No.
Okay, what about your Hep A? Do you think that's about the same time you got your Hep B?
Probably.
You said military. Okay, when's the last time you had your flu shot?
last year.
Okay. About September as well?
Yes.
Okay. Okay. And the MMR, you did say you had chicken pox. I'm sorry. MMR we're talking about, not the chicken pox. Was that in childhood that you received those vaccines? And have you had any boosters since?
I don't think so.
Okay. All right. When's the last time you had your physical?
This January.
January 2022?
Yes.
Fantastic. When was the last time you got your vision checked?
About a month ago.
Okay. Ooh, this year is flying, huh? Okay. Have you ever had an EKG?
Yes.
Do you remember when?
Probably 2 years ago
Okay.
in the VA.
Let's see, 2020.
Yeah.
All right. And about the time frame, do you remember?
Probably August.
August? Okay. Fantastic. Have you had to have a mammogram at this time in your life?
No.
No mammograms? What about a colonoscopy?
I've had one. Yes.
Do you remember those dates?
It was before I got out, so it was gonna be, let's go with 2015.
2015?
Yes.
Okay. And when's the last time you had your dental and hearing exams?
I had my dental this year, about 3 months ago, maybe 2.
Okay.
And I had a hearing test in January with my physical.
Okay. Fantastic. Have you ever needed a chest x-ray?
Yes.
Okay. And do you remember the date for that?
I think I got one about 2 years ago, 2020.
2020?
Yes.
Okay. And then when was the last time you received your PAP test?
I had one in January, February, shortly after my postpartum visit.
Of this year, correct?
This year.
Okay.
Yes.
Fantastic. Did those results come back normal for you?
Normal.
Okay, wonderful. All right. Do you have any type of allergy, drugs, food, anything else? No. All right. No known allergies. And then can you give me a list of your current medications and the dosage?
Taking prenatals
Okay.
once a day. I take an allergy medication
Okay.
that's as needed,
Okay.
and Adderall, 15 milligrams a day.
As needed. And you said 15 milligrams for the Adderall?
Yes.
Okay. And then why are you taking the Adderall? Is that a prescribed medication for
Prescribed.
you? Okay. And then is that for ADHD or
ADD,
different
yes.
condition? Okay.
ADD.
ADD. Thank you. All right. Prenatals, you're just keeping healthy, keeping body healthy?
Yes, because I'm breastfeeding.
Okay. Fantastic. And the allergy medication, is there a specific one or do you switch the doses? Or excuse me?
Centrosinide or?
Cetirizine?
Yes.
Okay. And what is that, about 10 milligrams?
10 milligrams.
And you said as needed?
Yes.
Okay, fantastic. Oh, that must be your baby. All right. Any herbal supplements you also take or anything else over the counter besides the allergy meds? Okay. All right. So we're going to check in with your family history. Is your father alive?
Yes.
Fantastic. About how old is he? Well, how old is he?
He is 62.
Fantastic. Wonderful age. Okay. Does he have any health-related issues?
No, he's fairly healthy.
Okay. What about your mother? How old is she?
She's 57.
And also healthy or any health issues with
No,
her?
she's got some health issues.
And you said 50?
57.
57, excuse me. Do you know what those issues are?
She has, I think she has high blood pressure.
Okay.
She has, she gets a lot of headaches, migraines. And she's got back problems.
Okay.
And I don't even know what else, but.
Okay. Those are the main ones troubling
Yes.
her. All right. What about siblings? Do you have siblings and any of them?
1 brother, 2 sisters, and they're healthy. No
Okay.
issues with them.
What are their ages?
My brother is 40.
Okay.
My other sister, she is 37,
Mm-hmm.
38, sorry. And my next one's 36.
Okay, fantastic. And you said no health problems with any of them?
No.
Okay. What about your children? You said you have 4. What are the ages?
14,
Mhm.
11, 7, and 10 months.
And all of them are healthy as well? Any
Yes.
problems with them? Okay. All right. And what about maternal relatives? Anybody have any major health issues on that side of the family?
My mom's side, I lost my grandpa to Alzheimer's.
Okay.
On my dad's side, I've lost two uncles, or great uncle, grandpa, or whatever it's called. He died from liver cancer,
Mhm.
but he was pretty old. And my other uncle died from cancer. I think it was blood cancer. I'm not sure.
Blood cancer. Okay. Thank you for that, and sorry for your losses.
Thank you.
Okay, so now we're gonna look at your current health history, okay? So in the past month, have you had any of the following problems? Any weight gain or weight loss?
No, not necessarily.
Okay, what about fatigue or weakness?
I'm tired, but I have a baby.
That makes sense. What about fevers, chills, or night sweats?
Night sweats.
Night sweats, okay. All right, what about headaches, dizziness, fainting, or loss of consciousness?
Just headaches.
Headaches, are those frequent for you?
I suffer from migraines every now and then.
Okay. What about numbness or tingling in any of your limbs or memory loss?
A numbness on my right leg mostly.
Okay.
It's from my lumbar injuries.
Okay. So you do have a connection there and it's
Yes.
verified. Okay. Fantastic. Okay, so we're going to look at your kidneys. Any frequent or painful urination?
No.
Have you noticed any blood in your urine?
No.
Okay, and then is it any hesitancy or straining while you're trying to urinate?
No. If anything, it's more like I sneeze and pee.
Okay, so I'm gonna say incontinence for that
Yes.
one. There we go. All right, and then have you ever had an abnormal pap smear? You mentioned the last one was normal. What about any past?
I have
abnormal
had
ones?
abnormal ones.
Okay, do you remember the year for that one?
The last one was in 2012.
Okay, and then do you suffer from irregular periods?
Yes.
Okay, how about vaginal itching or discharge?
No.
Okay, and are you noting any menopausal symptoms within yourself,
I think so.
such as?
Night sweats, mood swings. I mean, I don't have periods right now because of my IUD.
Okay. Okay, fantastic. Thank you for answering that. Okay, now I'm gonna say you said you suffer from migraines periodically.
Yes.
Are you noticing a pattern? Because it says frequent or severe headaches. Are you
No.
diagnosed with migraines?
I am.
Okay, got it. Any recent head injuries?
No.
What about vertigo or dizziness?
No.
Okay, good. And then any ringing in your ears or
Yes.
hard to hear?
Ringing.
Okay, and the loss of hearing is okay? Or are you able to hear everything?
I can hear fine.
Fantastic. Any pain in your eyes?
No.
Okay, what about redness?
No.
Okay, loss of vision or double or blurred vision?
I mean, I have bad vision to begin with.
Okay, and what about dryness?
No.
Have you noticed any watering or discharge coming from your eyes?
No.
Okay, and then do you have glaucoma or cataracts?
No.
Fantastic. Any redness or rashes on your skin anywhere?
I have eczema.
Okay. Sorry, spelling is hard sometimes. All right. Any bumps or nodules you're noticing that's not
No.
related to your eczema?
No.
All right. Any change in any moles that you have?
No, I don't have moles.
Oh, fantastic. And any change in your skin color?
No.
Okay. What about excessive dryness or moisture? Do you only notice it during the eczema that it's a little dry?
It comes and goes. Typically, the winter
Okay.
months, it's already happening.
Got you. Have you noticed any hair loss in yourself?
No.
Okay. What about change in your nails? Does the shape change? Does the color change at all?
No.
Okay. And then are they brittle? Do they break pretty easy? Or are
My
they
nails,
pretty
no.
strong?
They're okay.
Fantastic. All right. Next, I'm going to talk about your bones. Any numbness? Just the numbness in the right leg that you said?
Right, like it radiates.
Okay. Have you noticed any limited range of motion in any of your limbs?
No, my knees, but I have arthritis.
Okay. Military really did a number on you, huh?
No, always does.
All right. What about the joint pain or stiffness? Does that accompany the limited range of motion that you're
Sometimes.
experiencing? Okay. And then have you noticed any swelling in any of your joints?
No.
Okay, fantastic. Any pain or muscle cramps?
Sometimes.
Sometimes. And then any weakness? Have you noticed a change in your strength, your grip strength?
It sometimes.
Okay.
It depends.
Does it just randomly go out? Or
Yeah,
is it
randomly.
Just, okay.
Mostly on my hand.
There we go. Sorry.
Technical difficulties.
Yes. All right. How about anemia? You said that was only during pregnancy, correct?
Yes.
Have you ever been told you have a clotting condition? Do you suffer with clots? No. Fantastic. And what about excessive bruising? Do you bruise very easy?
No.
Okay. All right. Any discharge or bleeding from your nose, your mouth, your ears?
No.
Okay. Anything ever obstructed your nose, like a deviated septum?
No.
Okay. Have you noticed a change in your smell? Like, can you still smell certain items?
I have a pretty strong scent right now. I think it's my hormones with breastfeeding.
Got you. All right. Any pain in your mouth? Have you noticed any excessive scarring or any lesion
No.
showing up? Okay. And have you ever suffered like frequent sore throats?
No.
Okay. Do your gums bleed?
No.
Any toothaches?
No.
Okay, and we talked about the lesions. So I did ask in the mouth, but do you have anything on your tongue? Any lesions on your tongue? Okay. Changes in your voice?
No.
Difficulty in swallowing?
No.
All right, and has your sense of taste changed?
No.
Okay. Any pain or limitation of motion, limited motion in your neck? Are you able to turn your head everywhere? Fantastic. And then any lumps or swelling you notice around your neck? Okay. Do you suffer from depression?
Yes.
Excessive worry?
No.
Difficulty falling asleep or staying asleep?
Not necessarily.
Okay. Any difficulties with sexual arousal?
No.
Okay. Poor appetite?
No.
Any specific food cravings?
No.
What about frequent quiet crying or sensitivity?
No.
Okay. Any thoughts of suicide or any attempts?
No.
Okay. What about stress? Is your stress under control?
Yes.
Okay. Irritability?
No.
Okay. Poor concentration?
No.
Racing thoughts?
No.
Hallucinations or rapid speech?
No.
Guilty thoughts or paranoia?
No.
Okay. Have you do you do your monthly breast exams?
I try to. My friend reminds me.
Oh, wonderful. That's a good friend. Any pain you've noticed in your breast or any lumps?
No.
Any discharge you've noticed outside of your lactation for the baby?
No.
Okay, fantastic. Any chest pain or palpitations that you're feeling?
No, I have GERD though.
GERD? Okay. And then any shortness of breath or fainting?
Sometimes this is my air dart.
The shortness of breath? Okay. Are you noticing a pattern? Like, is it with working out or?
No.
Okay. I'll have to talk to the doctor about that. Have you had any swollen legs or feet?
No.
Okay. Any excessive coughing?
No.
Okay, fantastic. And we did mention mood swings earlier.
Yes.
Any anxiety you're having?
Yes, but it's controlled.
Controlled, okay. And then do you find yourself participating in risky behavior?
No.
Okay. All right. Have you noticed any nausea or heartburn?
Oh, my GERD.
With the
every now and
GERD,
then, yes.
okay. And what about stomach pains?
No.
Okay. Heartburn, no stomach pains, vomiting or jaundice?
No.
Any constipation or persistent diarrhea?
No.
Okay, what about blood in your stool, black stools?
No.
Okay, and then have you noticed a loss in appetite?
No.
Okay, fantastic. Are there any other problems that you feel I should have asked about?
No.
No? Okay. All right, so can you tell me your marital status? Are you married? Fantastic. And then what's the highest level of education you've received?
I have a master's.
Look at you, I love it. And then how do you learn best? Verbal instructions, written instructions, or pictures?
Well, pictures and
A little bit of
visual.
everything?
Visual. That's the word.
Fantastic. And then do you exercise?
I try to.
Wonderful. Can you give me an estimate about how many times a week and about the time frames of each of those sessions?
I try to for about at least 30 minutes walking,
Okay.
about 4 days a week.
4 days a week. Fantastic. And then do you have any religious preferences that I should know about?
No.
Okay. Any practices that could impact your health care, such as receiving blood?
No.
Okay. Any cultural practice that may impact your healthcare, such as needing to pray
No.
at certain times? All right. Now I'm going to ask, do you smoke?
No.
No. Have you ever used tobacco?
Yes.
Okay. How long has it been since you last smoked?
January 2021.
Fantastic. Okay. And do you drink alcohol?
Occasionally wine.
Okay. And then on those occasions, how much are you drinking in one sitting?
Just a glass. I mean, I'll take a glass maybe once every 3 weeks.
Okay. And then are you using any illicit drugs?
No.
Have you ever?
Yes.
Okay. And then do you remember those dates? Has it been some years?
It's been a couple years.
Okay.
Young and dumb.
Understandable. So I'd say maybe 10 years, so 2012
Yeah,
or
around
before
there.
then?
Before then.
Thank you. And then you said you're married, so I'm going to say you don't live alone. Is that correct?
Correct.
Okay. And then have you had any recent falls?
No.
Okay. And what is your current or past occupation? What do you do for a living?
I substitute every now and then. Other than that, I'm just a stay-at-home mom.
Okay. And then how much are you working as a substitute?
I try to pick up a shift once a week, 4 hours.
Week, 4 hours. Fantastic. And then do you have have an advance directive so your family knows what to do in
No.
emergent situations?
No.
Okay. And then would you like to receive information on how to get one of those?
Oh, yes.
Okay,
Please.
fantastic. Okay, Ms. Schweigert, so that completes my exam for today. I'll go get the doctor and let him know what's going on.
Okay, thank you.
You.
You can always edit that too.